Hi, my name is Greg Fell. I'm Director of Public Health in Sheffield. This is a short video on where we stand as of today. Most will have realised that Sheffield was identified as an area in need of enhanced support at the end of last week. Lots have asked, what does enhanced support actually mean? And to an extent that's up to us to define. There isn't a set template for what enhanced support means. We will be, and have already committed to, intensifying our strategy in all sorts of different spaces. The basic strategy remains keeping people safe and well, protecting the vulnerable and reopening Sheffield. But in that, we're intensifying our effort around prevention. That's kind of messaging, communication strategies, our approaches to events and gatherings, enforcement with a big hard edge D, and also softer enforcement. We are pushing really hard at minimising testing delay. You'll have seen us advocate on a number of occasions. If you have symptoms, get tested even if your symptoms are mild. We're pushing at optimising our contact tracing coverage. It's not good enough. The NHS Test and Trace reaches in the order of 72% of cases and contacts within 48-hour period. It should be well more than 80. So my ask of government is to get to well more than 80. That's the minimum recommended by SAGE. We stand ready to help government in that, and we've put together a funding proposal which is being considered by government at the moment. And in all of that, there isn't a single intervention that will be the thing that makes the difference. It's the package of interventions that arguably makes most difference. We're also seeking to optimise the package of support for Sheffield businesses. It's important that Sheffield remains open, and we want it to remain open. So we're asking government to support a range of measures to keep businesses afloat, particularly with regard to short-term cash flow. We still are seeking to avoid an imposed lockdown, or more to the point, the imposition of measures that restrict social movement, and particularly restrict social movement that has an impact on businesses, because that does economic and social harm. That may come, however. So it's important that whilst there isn't a single intervention that is the thing that makes a difference, it's important that the public, continue to stick with the programme, and the things that we can all do consistently to reduce the risk of spread of the virus is to act as if everybody else is infected. Keep your distance, wash your hands, wear a face covering, because if we all act in that way, then we reduce the spread. And then the City Council and other partners also need to work with government to improve things like access to testing and contact tracing. It's likely this situation will change over the course of the next week or so. The numbers are continuing to rise. As of this morning, the 7-day incident rate was in the order of 120, 130 per 100,000. I'm fully expecting that will rise. Mostly it's still in young working age people. If you look at the age cohorts, the cohort in which cases are rising fastest are in the 18 to 30s, and that's a consistent pattern up and down the country. However, there is spread into older people, and there is a small but significant uptick in the number of people being hospitalised, and within that the number of people who are needing ventilation support. So that's what we're trying to avoid, and that's why we'll continue to stick with the current strategy but intensify the interventions as we go.